A new COVID-19 wave is in the news. It appeared across several parts of Asia in May 2025. This development has understandably caused concern. Many people vividly remember the early days of the global pandemic. The memories of lockdowns, uncertainty and health worries are still fresh for communities worldwide. The re-emergence of rising case numbers brings back an unsettling feeling. Health officials and the public are now watching closely. They are trying to understand the scale of this new situation. Information is still coming in daily from affected regions. The SARS-CoV-2 virus, which once dominated global headlines, is showing signs of resurgence. This is not entirely unexpected by many in the scientific community. Viruses, especially RNA viruses like coronaviruses, constantly mutate. These mutations can sometimes lead to new variants. These new variants might spread more easily or cause different symptoms. People are now asking important questions. Is this current wave a significant new threat to public health? Or is it a less severe version of what we have seen before? The answers will depend on careful study. This essay will look closely at the current COVID-19 situation. We will examine the reported facts from different Asian regions. This includes places like Hong Kong, Singapore, and Thailand. We will discuss the new virus variants that are circulating, particularly JN.1. We will also consider what public health experts are saying about the severity. Their assessments are crucial for guiding public response. It is important to base our understanding on evidence. Understanding these current events is very important for everyone. We need to determine if this is a genuine public health crisis. Alternatively, we must consider if media attention is making it seem larger than it is. Sometimes news coverage can create a sense of alarm. It is vital to think critically about all the information we receive. We must separate factual reports from speculation. This will help us respond appropriately to the situation. Personal understanding leads to better community health. Several parts of Asia are reporting an increase in COVID-19 cases. Hong Kong, for instance, experienced its highest rate of positive respiratory samples in over a year. In the week ending May 3, 2025, authorities there reported 31 severe COVID-19 cases. This figure marked a 12-month peak for such cases in the city. Wastewater surveillance also indicated that community transmission was expanding. These indicators suggest a notable rise in viral activity. Health services are monitoring admissions closely. Singapore also saw a significant rise in infections. COVID-19 cases there went up by 28% in the week ending May 3, 2025. This increase translated to approximately 14,200 new cases. Hospital admissions in Singapore also increased by about 30% during this period. In mainland China, positive COVID-19 test rates in hospitals more than doubled. This happened over the 5 weeks leading up to May 4, 2025. There are indications of a potential wave similar to the previous summer. Thailand reported significant outbreaks following the Songkran festival in April 2025. As of May 16, 2025, COVID-19 cases in the country had surged past 71,000. Sadly, 19 deaths were reported in a recent period connected to this surge. India, in contrast, had a relatively low number of 257 active COVID-19 cases as of approximately May 21, 2025. However, some states, such as Maharashtra, saw their active cases increase. Maharashtra's active cases rose from 12 to 56 within just 1 week. The JN.1 variant is one of the main virus types currently circulating. It is a descendant of the BA.2.86 Omicron subvariant. The World Health Organization has classified JN.1 as a variant of interest. Importantly, the WHO considers its global public health risk to be low at this time. Symptoms associated with the JN.1 variant are generally reported as mild. They often include fever, runny nose, sore throat, and headaches. Most people improve within 4 to 5 days. Health authorities in affected Asian countries are taking proactive steps. In Hong Kong, Singapore, China, and Thailand, officials are urging people to get booster vaccinations. This advice is particularly aimed at high-risk groups. These groups include older adults and individuals with underlying health conditions. Immunity from previous vaccinations or infections can wane over time. New booster shots are designed to enhance protection against currently circulating variants like JN.1. These campaigns aim to reduce severe illness. Countries in the region are also reportedly re-establishing data-sharing practices. Good communication and information exchange are vital during any health event. Public health communications are being strengthened to keep citizens informed. Booster vaccination campaigns are being intensified to reach more people quickly. For example, Ho Chi Minh City in Vietnam advised its residents to wear masks in public around mid-May. Similarly, Bangkok issued a COVID-19 warning, partly due to concerns as schools reopened. These are localized responses to specific conditions. The resurgence of COVID-19 cases during the summer months in some Asian regions is noteworthy. This pattern contradicts some earlier assumptions. Many initially thought the virus would predominantly follow seasonal flu patterns. Influenza typically peaks in the cooler months in temperate climates. However, these recent COVID-19 waves are occurring in warmer weather. This observation highlights that the SARS-CoV-2 virus can still behave in unpredictable ways. It adapts and spreads under various conditions. We have learned a great deal from the initial years of the pandemic. Pandemics often occur in multiple waves. New variants of a virus can emerge. These variants can sometimes change how the virus spreads. They might also alter the severity of the illness it causes. Therefore, it is crucial to continuously monitor these changes. Following the guidance of official health authorities remains very important. Their recommendations are based on the latest data and scientific understanding. This helps protect communities. So, is this current situation a new major public health threat? Or is it perhaps a distraction amplified by media focus? The available information suggests a mixed picture. Symptoms associated with the dominant JN.1 variant are mostly mild. Health officials in both Singapore and India have reported that current cases are generally not associated with unusual severity. This is reassuring. However, Hong Kong did report a 12-month peak in severe cases. This reminds us that vigilance is still necessary. It is vital to stay informed through credible and reliable sources. Official public health websites, such as those from your local health department or the World Health Organization, are excellent resources. Reputable news organizations that focus on factual reporting are also important. It is wise to be cautious about sensational headlines or unverified information shared on social media. Such sources can sometimes cause unnecessary fear or spread misinformation. Accurate information empowers sensible decisions. We all have a significant role to play in managing this ongoing situation. Personal responsibility is a key component of public health. Simple hygiene measures continue to be effective. Wash your hands regularly with soap and water, or use an alcohol-based hand sanitizer. Consider wearing a mask in crowded indoor public places, or if you feel unwell. If you are sick, it is best to stay home to prevent spreading any illness to others. These small actions collectively make a big difference. Critical thinking is absolutely essential as we navigate these developments. Look at the data presented. Consider the source of the information carefully. Strive to understand the difference between the number of reported cases and the severity of the illness those cases represent. An increase in cases does not always mean an equal increase in severe outcomes. By staying vigilant, informed, and personally responsible, we can manage this new phase of COVID-19. We can protect our health and our communities without giving in to undue alarm.